101.1 FM and AM 1160. Thanks for being with us here on this Thursday morning. A conversation next with Hayley Robson, who joins us this morning from the Hayley, I'm going to get the name wrong. I probably shouldn't even try it, but I'm going to try it. You ready?
Yep.
Um, Weight Management and Bariatric Surgery Institute at IRMC.
You got it.
Hey, ta-da! Well, it's we had Dr. Brian Walkowski on with us a couple of weeks ago, and since that time, we're hearing all kinds of people are interested in bariatric surgery and what it means and what it's all about. And you're the person we need to go to learn all about it because
Yes.
you've got an event coming up.
We do. Actually, on January 22nd, we have an event at the Wellness Center, and that's just going to be a very informational session promoting the bariatric program. Dr. Wakoski will also be there to speak with everybody. You'll get a tour of the Wellness Center. There's a chance to win a Fitbit. You get some memberships. 3-month membership to the Wellness Center as well. So there's lots of perks. If you go to irmc.org, you can RSVP to that for us, and we can get you signed up to come visit with us and find out more about the program.
Now, you're a registered nurse.
I am.
And you're the coordinator of the Institute, right?
Very much so, yeah.
Okay, so that being the case, you know how people feel about bariatric surgery and their anxieties about it and their hopes for it, don't you? You probably hear both sides of that.
Both sides. I mean, a lot of people come in with a lot of fears, a lot of questions, but our program is very much patient-based, and we go at the progress that you want to go at. So, we can put you in that program as fast as possible and get the ball rolling, or, if you want to visit with our medical bariatrician, Dr. Mahmood, you can kind of follow with her until you feel like you're ready to have surgery, at which point we can send you to our bariatric surgeon, Dr. Wakoski. So we are very much working at your pace, making sure you're comfortable, because it is a huge lifestyle change. So I get the fears. I get that it's a big change. And so we want to make sure that you're comfortable with it before you make that big step.
And this event on the 22nd is going to answer a lot of those questions.
Very much so, yes.
Yeah. All right, so we'll look forward to that. What are some of the questions that people have about it? And you mentioned the fears and the anxieties that people have because it is a major procedure.
It is. It's very similar to if you would need your gallbladder removed, something along those lines. We just get fears because, one, it's surgery. A lot of people don't want to have surgery, so we get that. And, going under anesthesia can be scary. But like I said, it's very much like a gallbladder surgery, and the complications are very few and far between. Some other questions that we get, am I going to be able to eat what I want to eat or as much as I want to eat afterward? And that's why we see you for 6 months or so prior to you having surgery, because we go through all of those diet modifications that you'll need to continue with after surgery. We try and make sure that you're prepared as possible and almost living the lifestyle that you would have to after surgery, prior to surgery, so that you know that you can handle it.
Yeah. Oh, boy, I bet you that's a big step, though.
It is. Yeah. It is. It's a lot for a lot of people. And, if as long as you're committed and you're willing to take that step, you will be successful.
Yeah. A big term, of course, in surgical procedures these days is minimally invasive, exactly. Which this is.
It is. It is a robotic procedure, minimally invasive. So you just have a few small incisions on the belly. It is a 2-day hospital admission, just so that we can keep track of you, make sure that your diet is progressing in the fashion that we want it to, and that you're able to tolerate everything. But other than that, it's very minimally invasive, yes.
Now, bariatric surgery is something that both men and women do. Does it skew one way or the other? Is it more women or more men?
I don't know that it does. I think we see more women interested in it, but I don't know that there's a currency more in women than men that actually have it done. I think women just come to us more with that interest.
And as I recall talking to Dr. Walkowski, he was talking as well about the lifestyle changes. This is not just, okay, get the surgery done and eat less carbs. It's much more than that, and it involves total lifestyle change, doesn't it? It's for people who really want to get control of their weight that have struggled with it all along.
Exactly. So this is just an aid for you. It's not going to be an all cure. You have to be able to put in the time and the effort and the other modifications to make it worthwhile and make it successful. So, there are some diet modifications, but like I said, you're going to experience those prior to surgery and make sure that there's something you're going to be able to withstand after surgery. And it's, we're not talking that you're only going to be able to eat, salads for the rest of your life. You can still have, what you want to eat. It's just in modifications. And we work very closely with the dietitians through the Institute of Healthy Living, and they help counseling the patients for dietary modifications the whole way through the process.
For this event coming up on the 22nd, that 3-month membership to the S&T Wellness Center, that's not something to sneeze at. That's a big deal.
That is a big deal, a very big deal. I would jump on that myself.
Sure,
yeah.
Sure, because you'll get a tour of the facility, and then you'll have the chance over the course of 3 months to use the facility.
Exactly.
And that can be a part of what happens after the surgery, too, is
yes.
You continue at that facility or somewhere else, but it's the beginning of a lifestyle change that involves physically becoming an active person. It changes you.
It does, very much so. Physically, appearance-wise, it changes you. There's a lot of things, a lot of factors that it changes. It can change your health. If you have a history of diabetes or hypertension or sleep apnea, all of those things can possibly be, brought down. You can have treatment of those in a sense if you lose the weight. So if you have those comorbidities, it's helpful to lose the weight. Surgery might help that.
So since the Institute became a thing at IRMC and you've been working with it, I'm sure that you've had some notable stories of success and as you move forward and watch people with their recovery from the surgery and then moving on with their life, those success stories become even more heartening.
They are, and I see these patients from day one the whole way through, and so it is really nice to see, when they come in and get their weight done, that the scales have moved down, and just the joy on their face, knowing that what they're doing is helping, and what we're doing is helping, is such a reward, and I think it proves to the patients that, okay, I can do this. So it's definitely rewarding.
Yeah, and as those successes come along and the victories come along, it changes the mental outlook too, doesn't it?
It definitely does. Yeah, I mean, you see these people, unfortunately, weight is something that causes a lot of mental disease in people, and when they lose that weight, you just see a new person come out in them, and it's a new person for the better.
Yeah. As I recall talking to Dr. Walkowski, that's one of the things that he likes most about it is seeing the change in people, their outlook on life changes, their energy level changes. Everything gets better.
Yes, very much so.
Yeah. Okay, so the procedure itself that people undergo, let's allay some of the fears that they have right now. This is not going to be something where you're getting cut open and then there's this long recovery process because you're cutting through layers of muscle or things of that nature. No internal organs involved other than the actual procedure of taking care of the bariatric surgery. It's not something that is going to be a long, painful process.
Not at all, no. Like I said, it's done robotically, so just a few small incisions in the belly. And when you have your surgery, you have a little bit of pain after. We take care of that while you're in the hospital, but once you get home, it should get better day by day. And then we progress your diet slowly so that you don't have any complications related to it. And then you follow up with us so we know if you're having any issues post-operatively, we can take care of those right away for you.
Pretty good team that you have there too?
Great team. I love the people I work with. Yeah.
How many people are we talking about?
So I'm the coordinator, and then we have the medical bariatrician, Dr. Mahmood, the bariatric surgeon, Dr. Wakoski, and then we have some of the staff in the office that help room the patients. And then, like I said, we work hand in hand with the Institute for Healthy Living dietitians that they come in during Dr. Wakoski's visits as well to visit with the patients. So a small little group, but that keeps consistency for the patients, and I think they appreciate that.
It's really good, too, that IRMC provides, for instance, with the team at the Wellness Center, the nutritionists, everybody involved. You can use other elements of that hospital family, bring them all together for one outcome that is going to benefit the patient.
Exactly, yes.
Terrific. Okay, so tell me again how people can become involved if they have questions. Whether they can make it to the event or not, they can always contact the Institute.
Absolutely. I'm always available if you need to give me a call. We are located in the general surgery office in the IASA building right next to the hospital. Our phone number is 724-349-3682. 3170. And you can call at any time and ask questions. I'm always available to answer those for you. Or you can go on to IRMC.org, and there is a section for weight management on there that should be able to answer any questions you may have as well.
And, of course, the event on the 22nd, tell people how they can get to that.
Again, on the IRMC.org, there is a section. If you go to the weight management page, it prompts you for the seminar, and you can RSVP right there on that page.
There you go.
Yeah.
There you go. It's the 22nd at 10 a.m.?
10 a.m.
10 a.m. at the S&T Bank Wellness Center.
Yep.
Along Shelley Drive.
That's right.
Hayley, thank you so much.
Thank you.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160. Coming up, Boomer has our CBS Sports, and then we'll follow up that with Josh in the newsroom. Actually, I think Marky's here in the newsroom, and then a check of sports is on the way, too. Indiana in the Morning